Hello aspirants, welcome back to KNO Academy YouTube channel. In this video, I will be discussing about previous year RRB question paper that was held on February 2025. First question is, which is the most significant risk factor for development of renal cancer? Options are renal stone, cigarette smoking, pyelonephritis and second degree relative. Actually, in this question, they are asking about significant risk factor, right? So, the strongest risk factor for development of renal cancer is smoking, and the obesity is another major risk factor. So the answer will be cigarette smoking here, okay? And other risk factors are high blood pressure, chronic renal failure, and occupational exposure to certain chemicals such as trichloroethylene, okay? And the second question is how many cycles of CPR to be given followed by one shock? If the victim has a shockable rhythm while providing advanced life support in cardiac arrest, the options are 3, 5, 4, and 2. So, in this question, they are asking about how many cycles of CPR you will give after a shock. We all know that in advanced life support scenarios, we are going to provide shock and we will rush him to CPR, right? So, the CPR should be given about 5 cycles for 2 minutes, okay? Remember that 5 cycles for 2 minutes, not 2 cycles. And the third question is in stage 3 hypoimmixia, the patient will have blood loss of the options are 20 to 30 percentage, 10 to 20 percentage, 40 to 50 percentage, and 30 to 40 percentage. Actually, in stage 3 hypovolemia, the patient will have blood loss of 30 to 40 percentage. Okay, here is the chart for classification of hemorrhagic shock. In stage 1, it is about less than 15 percentage. In ml means it will be less than 750 ml. In stage 2, it is about 15 to 30 percentage. In ml, this is about 750 to 1500 ml. In stage 3, it is about 30 to 40 percentage, and in ml, it is about 1500 to 2000 ml. In stage 4, this is about greater than or equal to 40 percentage. In ml, this will be greater than or equal to 2000 ml. And the fourth question is in Partraph, number of uterine contractions and duration of each contraction in chart is every dash minutes. Options are 30 minutes, 60 minutes, 15 minutes, and 45 minutes. Actually, in Partraph, the uterine contractions are charted every 30 minutes because the each square is about half an hour. So, we have to chart the contractions in every 30 minutes. Okay. And the fifth question is which hormone is responsible for dilatation of cervix in the first stage of labor? The options are follicle stimulating hormone, estrogen, luteinizing hormone, and testosterone. Let's decode the each options. First, the follicle stimulating hormone. The primary function of this FSH is development of follicles, right? So there is no role in cervical dilatation. And if we take luteinizing hormone, the primary role is triggering of ovulation. So there is no real role in cervical dilatation. And about testosterone, it is a male hormone. So this have no role in cervical dilatation, right? And estrogen. It plays a crucial role in cervical softening during pregnancy. How? Because this estrogen stimulates the release of prostaglandins. We all know that prostaglandins are hormones that directly cause the cervix to dilate and softening. So this estrogen will help in dilatation of cervix during labor. And sixth question is urea breath test is done for identifying infection of gastric mucosa with which microorganisms? Options are Escherichia coli and Helicobacter pylori, Shigella and Salmonella. We all know that urea breath test is specifically used to detect the presence of Helicobacter pylori, right? This Helicobacter pylori bacteria is resides in stomach. So how this test works? In this test, the patient will have the patient will drink some solution that contains urea, which is then broken down into carbon dioxide by presence of Helicobacter pylori in the stomach. The amount of CO2 in the patient's breath is measured after a certain period of time. Here we know that urea is given, right? And the breath is measured. So this is urea breath test. In this breath, if the patient's amount of CO2 is risen means this indicate there is a infection of H. pylori. And other options are E. coli. It is a gram-negative bacilli primarily resides in intestine and it is the main reason for UTI. Okay, and Shigella, it causes diarrhea and dysentery. and Salmonella, especially Salmonella type, which causes typhoid fever. Okay. And seventh question is, which of the following is a symptom of shock? The options are rapid breathing and weak pulse, and high blood pressure, warm, dry skin, and increased energy. Let's decode the each options. We all know that shock is typically characterized by hypotension, right? So due to hypotension, the skin will be cold and clampy. So we can eliminate this B and C options. Increased energy is not associated with shock because patient in shock is already in the state of stress. So this results in fatigue and dizziness, right? So the right answer is option A. In shock, the patient will have rapid breathing and pulse rate will be high, tachycardia. Here I have a question for you. In which type of shock the patient's body is warm to touch? Comment your answers in comment box. And the eighth question is, which of the following eardrop is used for the treatment of swimmer's ear? The options are hydrogen peroxide, acetic acid, carbamide peroxide, and glycerin. Actually, in this question, they are asking about treatment for swimmer's ear, right? What is swimmer's ear? It is also known as otitis externa, which means the infection of outer ear canal, right? In this question, they are asking about treatment. So the answer will be acetic acid because this acetic acid has properties of antimicrobials which will kill the fungi or bacteria that causes infection, and other options like hydrogen peroxide, carbamide peroxide, and glycerin, those do not have any antimicrobial properties, so these are not treatment for this famous yes, but it can be used for soften the ear waxes. And the ninth question is, the social process of cooperation and accommodation is present in personal process, associative process, universal process, and dissociative process. The social process can be classified into two types. One is associative and another one is disassociative. This associative includes cooperation, accommodation, assimilation, and acculturation, whereas this disassociative includes competition and conflict. So here the answer will be associative because the accommodation and cooperation is comes under this associative process, right? And tenth question is, the process whereby the genital organs revert back to approximately state as their pre-pregnancy state after delivery is called. Hmm. The options are involution, retroversion, regeneration, and puerperium. We all know that the genital organs which are going back to the pre-pregnancy state after delivery is called involution. Here, the retroversion means the anatomical position of uterus during pre-pregnancy state. And puerperium, we all know that after delivery of the baby, the following 6 weeks is also known as puerperium or postpartum period. Okay, a stage. And 11th question, the condition when the membranes are ruptured before onset of labor is called. The options are early rupture, late rupture, spontaneous rupture, and premature rupture. Let's decode the each options. Early rupture. It means the rupture of membranes, I mean the amniotic membranes before 37 weeks of pregnancy. It is called as early rupture. In late rupture, the late rupture of membranes occurs after 37 weeks of pregnancy. Premature rupture, this is not associated with any weeks of pregnancy. This can happen before 37 and or after 37, but the important thing here is the premature rupture of membrane occurs before onset of labor. Okay, so the answer will be premature rupture of membrane. And the last question of this section is, which among the following layer of coronary artery blood vessel get blocked and narrowed by fatty substance in the atherosclerosis? The options are tunica adventitia, tunica media, tunica intima, and tunica mucosa. First, we have to know that what are the layers of artery. Actually, arteries has three layers. The innermost layer is tunica intima, and the middle layer is tunica media, and the outermost layer is tunica adventitia. So we can eliminate the option D because this is not a layer of artery, right? These atherosclerosis plaques are primarily affect the innermost layer of the wall. It is also known as tunica intima. So the answer here is tunica intima. If you look at this image, this part is known as adventitia and this part is medium and this part is intima. The atherosclerosis plaques are obstructing the tunica intima flare, right? So the answer is tunica intima. So that's all about it today's question section. If you like this video, share this video with your friends and follow our KNO Academy YouTube channel for more MCQ sections.